Hello, good day everyone. I am going to discuss how to assess the abdomen. In preparation, the first thing you need to do is to assemble equipments and supplies, examining light, tape measure, water-soluble skin marking pencil, and the stethoscope. So, let's begin the procedure. The first thing you need to do is to explain to the client what you are going to do, why it is necessary, and how she can cooperate. Wash hands and observe other appropriate infection control procedures. Provide for client privacy. Next, you have to determine the client's history. Incidents of abdominal pain, its location, onset, sequence, and chronology. Its quality, its frequency, and associated symptoms. Bowel habits, incidents of constipation or diarrhea, change in appetite, food intolerances, food ingested in 24 hours, specific signs and symptoms, and previous problems and treatment. Assist the client to a supine position with the arms placed comfortably at the side. Place small pillows beneath the knees and the head to reduce tension in the abdominal muscles. Expose only the client's abdomen from chest line to the pubic area to avoid chilling and shivering, which can tense the abdominal muscle. You have to inspect the abdomen for skin integrity. Check for any masses, any abnormalities, any areas of discoloration should be noted, and the movement of the abdominal wall with respiration. Next is to inspect the abdomen for contour and symmetry. The general contour of the entire abdominal wall is observed. Contour should be checked carefully for distension. Also, inspect the abdomen for any bulging. Ask the patient to take a deep breath and to hold it. Assess the symmetry of contour while standing at the foot of the bed. As you can see, there are no masses or protrusions that make one side of the abdomen bigger than the other, a good sign or indication of a healthy abdomen. If distension is present, measure the abdominal girth by placing a tape around the abdomen at the level of the umbilicus. Observe abdominal movements associated with respiration, peristalsis, or aortic pulsations. Observe the vascular pattern. The mass should be examined for movement with respiration. Also, the mass should be observed for peristalsis as it may well represented dilated bowel. Normally, the abdominal wall moves posteriorly in a symmetrical fashion with inspiration. Auscultate the abdomen for bowel sounds, vascular sounds, and peritoneal friction throbs. We are gonna listen to all 4 quadrants. You should hear 5 to 30 sounds per minute. If you don't hear any bowel sounds, you'll need to listen for 5 full minutes. Also, you need to know if these sounds are normal, hyperactive, and hypoactive. Forecast several areas in each of the 4 quadrants to determine presence of tympani and dullness. Use a systematic pattern. Begin with the lower left quadrant, then proceed to the lower right quadrant, the upper right quadrant, and the upper left quadrant. Doing this, we will look for any tenderness or pain. Cast the liver to determine its size. Perform light palpation, first to detect areas of tenderness and for muscle grading. Just feel or look for any lumps, masses, any abnormalities, and the tenderness and pain of the patient. Perform deep palpation all over the 4 quadrants. Again, look for any masses, lumps, bumps, and any abnormalities and tenderness and pain of the patient. Palpate the liver to detect tenderness and enlargement. Palpate the area above the pubic symphysis if the client's history indicates possible urinary retention. Lastly, document findings in the client record.